Hello, everybody. Welcome to the Thyroid Pharmacist Healing Conversations podcast. I'm your host, Dr. Izabella Wentz. And today we're going to be talking about a topic that I know is near and dear to the hearts of many people with thyroid illness. We're going to be talking about fatigue and chronic Epstein-Barr virus. I have Dr. Kasey Holland here with us today. She is a naturopathic doctor based in Montana, and she's passionate about empowering people in their health. She helps people navigate complex health concerns and restore health and vitality. As a licensed naturopathic doctor, she believes that your health is made up of mind, body, and spirit. Through her through her clinical experience, she has seen environmental toxins, infections, chronic inflammation, and stress disrupt these pillars of health. She is somebody that specializes in complex and chronic cases, often related to what she calls the toxic trio: Epstein Barr virus, Lyme disease, and mold. Her specialties include chronic fatigue, Epstein Barr virus, and stealth infections, mold illness, environmental toxins, digestive issues, and hormonal imbalances. Dr. Kasey, it's so wonderful to have you here. Thank you so much for taking time to connect with us.
Thank you for having me, Dr. Isabella. I've been really looking forward to it.
I know a lot of us have our own stories of how we got into health, perhaps, maybe from doing something else prior to that. And it could be a family member, it could just be a passion, it could be our own health. And I'm curious, what made you so passionate about helping people with chronic complex illness?
Yeah, that's a great question. I was sick as a child. Um, I had mono, like the initial onset of it when I was in grade school, and I missed about 3 months of school. And that in and of itself was difficult. But we kind of thought, I got through it and things would be okay. And then actually when I was in naturopathic medical school, I had the same fatigue and didn't feel well. So at that point, I had decided, that I wanted to go and help people. And the years leading up to that is kind of a really long story of other health issues that popped up and things. But I was in naturopathic medical school and I went to our clinic where we did our rotations. And I said, I feel like I have mono again. And they were like, well, you've already had it. And I was like, I know, but I feel like I have it again. And they did a mono spot on me, which we'll talk about testing. I know Dr. Isabella wants to talk about that. But basically, they, kind of were just like, well, you're just tired because you're doing a lot, get some more rest. And so, even though I chose integrative medicine, I was still kind of not getting that all comprehensive and just deep dive into health. And it was myself that diagnosed myself with reactivated EBV and had patients that had the same symptoms as me and saw no, we need to run all of these labs. And so after that happened to me, I just started sharing about it on Instagram because I was trying to heal and I saw all these other people at that time. Anthony Williams' book Medical Medium also came out. And so everybody was like, oh, EBV, it's EBV. And that's kind of how this came about, was just my own healing process. And then during my residency, I actually did a rotation where pretty much all I saw was chronic illness, and everybody that came in had a viral panel done. And so that was really good for me to be able to see all of this and see what was working and what wasn't working.
Thank you so much for sharing that. And, I can relate to that. And I feel like you were fortunate to be going to naturopathic school. I was in undergrad and I was like, this is when a lot of my health challenges started. And I remember getting basically mono my first year in college. And I used to be like this super bright eyed and bushy tailed high school student, got into like a great university and so on and so forth. And then all of a sudden it was like I was sleeping until noon. I remember I essentially went to bed to take I came home from class to take a nap and at like 3 o'clock and I had an exam the next morning. And I'm like, I'm just going to study for the exam after I wake up from my nap. Well, I didn't wake up from my nap until like 8 a.m. the following morning, and my exam started at like 7:30. And so I was like, holy cow, I just woke up and I like ran to where the exam was. Walked in late, like crying. I hadn't studied, and they were gracious enough to let me like still take the exam. I don't think I got a very good grade by any means at that point, but it can be very, very devastating for a person to go through Epstein-Barr virus. And I know a lot of people that I've worked with, they say they're like never quite the same after they have a bout of Epstein-Barr virus, and they end up just struggling with chronic fatigue. And conventional medicine isn't as helpful. I know I went to pharmacy school, and as far as like the chronic fatigue, and this was 20 plus years ago, but they were like, chronic fatigue syndrome and fibromyalgia, we don't really know if it exists or not, or if it's like in patients' heads. And it wasn't really until like more medications became available for fibromyalgia where I feel like conventional medicine had started taking it more seriously. And so I feel like a lot of people, and even myself being a trained healthcare professional, I was like, I'm exhausted and I'm fatigued, but there's nothing really I can do for myself. I remember, I think Provigil was offered to me for like the fatigue and hypersomnia that I had. Like I was just constantly sleeping, just exhausted. And they were like, well, if you had insomnia, we'd have a whole bunch of drugs to give you. But with sleeping too much and being tired, there really isn't much help offered. So I really, really appreciate that you are specializing in this and that you are advocating for people and educating people, and that you're a safe place and a resource people could go to when they've been struggling with this. Um, can we back up for a minute and talk about what is Epstein-Barr virus, and what is that connection with Epstein-Barr virus and chronic fatigue syndrome? Because you have people that say Epstein-Barr virus can lead to chronic fatigue, and then you have people that say everybody has Epstein-Barr virus. Can we get into the nuances of that?
Yeah, definitely. And thank you for sharing your experience. It's really when you talk to people about this, like looking at you, I'd never guessed that you went through something like that, or looking at me. And it's just because you look fine a lot of times and but you feel like, you can barely make it through the day. So thank you for sharing that, because I just think it's so people just assume that we look great, we look fine. Yeah, let's talk about that. So Epstein-Barr virus is a human herpes family virus. And so you might think of, shingles, things like that, um, and herpes oral. Uh, that's the same family. So that's the type of virus it is, which means that it stays in the body. So it's unique. It doesn't go away. It's not like a bacteria where we can just wipe it out with antibiotics or kill it. It's going to be integrated into the body. And the good news is that it goes into what's called a latent or an inactive state. That is where it's just there, but it's not replicating. When it's active, it's the medical terminology is lytic and cycling, and that's when it's causing problems. So, with chronic fatigue syndrome, sometimes it gets a little confusing because you can have fatigue and not be chronic fatigue syndrome diagnostic code. So a lot of people that have chronic fatigue syndrome are actually bedbound and very, very limited in what they can do, and their fatigue is very extreme. And so sometimes people will say they have chronic fatigue syndrome and they're working and whatnot, but they don't feel well. They're going to school. And so that diagnostic criteria can be interesting. And so can the diagnosis of chronic Epstein-Barr virus. There is a diagnosis. The short term is CAEBV, or chronic active EBV. And this is when EBV is very much infiltrated in multiple types of immune cells and typically results in more severe cases. Um, Typically, what I see in practice and what most of us are dealing with when this virus is present is a reactivation of Epstein-Barr virus or mono. So, mono is what most people are familiar with. Usually, you get it by the time you're in middle school, high school, sometimes college. Like your first time was college, so sometimes it is college for people. Over 95% of us have been exposed to EBV. Like it is like a germ on the street, it's part of our environment. We're not going to get away from it. And so that has led to people downplaying it and being like, well, we would all be sick. We would all be exhausted. And the problem is that, yeah, we're all exposed, but not everybody has it reactivate. And that's the difference there. So that's why it's unique is it can come back. So what we're talking about typically here is either the first time that somebody gets it, which is typically deemed mono or the kissing disease because it's spread through saliva and bodily fluids, or when it's reactivated. And the reactivated portion has just become extremely prevalent. I think part of the reason is because, like you were saying, there's more information, people are paying more attention to it. And then also, there's things that have happened, like the pandemic, where everybody was under a lot of stress. They may have had COVID, and that triggered reactivations as well. The way that EBV causes fatigue when it reactivates is it's similar to mono, but usually there's other factors involved that we'll talk about when there's a reactivation. And so when the virus goes from inactive to active, it turns on different proteins in the body that are basically interfering with our cellular regulation, putting stress on the thyroid, adrenals, our overall homeostasis with inflammation. And that is what causes a lot of long term fatigue.
That makes a lot of sense. And I know that there's one of my pet peeves is that people will get tested for Epstein-Barr virus. And even like amazing functional medicine doctors sometimes don't run the correct tests for reactivated Epstein-Barr virus because there are a few different tests that we can run. And some of them tell us that we have a past infection. Some of them tell us that we have like an active infection. Some of us can tell us that it's reactivated. Can you chat through? And I've also heard some people say, like, well, if these levels are really high, and even if it's not reactivated, then you should still treat this. Could you get into the nuances for that for people and maybe share some of the lab tests that they should be asking for when they're suspecting Epstein-Barr virus might play a role in their symptoms?
Yeah. So the first thing that I think helps just kind of understand and picture what we're testing is the actual virus. So the virus has a capsule around it, and we some of the labs are called viral capsid antigen. That's your body responding to that portion of it. And then there's the nuclear material inside. And that's when the test is labeled nuclear antigen. That's what we're looking for. So what is typically tested and what happens, and I mean, this is like what happened to me in school, right? We literally did not learn in school how to check for reactivation. We learned the basics. This is EBV, this is mono, here's the mono spot. The mono spot only checks IgM, viral capsid antigen IgM, or on your lab, it'll say VCA IgM. And that's the initial body's immune response to the virus. In some people, when it reactivates, this will also go positive. In school, this didn't happen. The IgM only goes positive once and then it never happens again. And then in practice, I'm sitting here and I'm like, I have like records. This has happened twice now, three times. So it does sometimes show positive with reactivation as well. And then, but really, if you are only checking that and it's negative, they'll say, oh, you're fine. It doesn't mean that you're fine. So the rest of the panel checks the IgGs, which is after your body's initial immune response, you have soldier cells that come in for a second wave of your immune response. And the viral capsid antigen IgG, that's what we're looking at. And then we also have a nuclear antigen IgG. So on the lab test, it'll say VCA IgG and then EBV. It'll either say NA IgG or nuclear antigen IgG. That's that portion of it. But this can stay positive for a long time after an initial infection. It can stay there for life. And so people will say, well, that's just positive because you already had it. It still doesn't mean that you're sick. So there's another lab called the early antigen IgG, and we run that. If that's positive, that's very indicative of a reactivation. And that's nice when I mean, it's not good that you're dealing with that, but it's nice because it gives us clarity when that's positive. However, that typically only stays positive for about 6 months. So sometimes that will have gone negative, and then we still have this person that doesn't feel well. And usually their IgGs that, last forever are really high, like 10 to 100 times normal. And when that happens, if you're symptomatic and that is high, I treat it as though you have a high viral load still. And that's what most people trained in this realm do. I think that part of the problem here is that virology is so complex, and I don't think we have all the answers or labs that can actually test what we're trying to. And that's where, yes, I use labs and they are very, very important. But we have to also think of the patient's history, their health picture, what else is going on in their life, and how they feel.
Thank you so much for sharing that. I know I've seen people where they just don't get the early antigen tested, and I feel like that's such an important test to do, but then there's also, um, these other markers that might be missed as well because sometimes one of the other markers may indicate that you are reactivating or may indicate that actually like this immune response like you had this so many years ago, why is it still so high? And those might be opportunities for intervention, and addressing those markers can actually help to get a person feeling better. So I really appreciate you walking through that because some people will say like, oh yeah, my doctor said it's like I just had it in the past. And I really appreciate that you go deep into it and like you kind of check the boxes that need to be checked. There are a lot of people that think that Hashimoto's is triggered by Epstein-Barr virus, and I will tell you, like, I feel like there's not just one trigger of Hashimoto's, but I absolutely can say that is, in my experience, that can definitely be the case for many people. This can be a very relevant trigger. Have you seen that as well? Have you seen Epstein-Barr virus to be a trigger for various health conditions, autoimmune conditions?
Yeah, we have research published linking Epstein-Barr virus to 7 different autoimmune conditions and then some. And that research, some of it has been there for a long time, some of it is newer. There's actually a lot of new research on a direct link between Epstein-Barr virus and multiple sclerosis. And we've known for a long time that viruses can trigger autoimmune conditions. And the reason is, as I was talking about before, is these proteins and inflammatory markers and regulatory systems of cells that get changed when Epstein Barr virus is turned on. Epstein Barr virus turns on NF kappa B and dysregulates that. And that's one of our body's biggest kind of inflammatory response. So I definitely think it's a factor. I agree with you that I don't think it's the only thing that contributes, obviously. And that's when we really have to look at what also is making it so that your body. So, one thing that we should really make sure to highlight is that Epstein Barr virus is an opportunistic infection. It means that our body's immune system, a healthy immune system, is designed to keep it in an inactive state where it's not causing problems. So if that's happening, we really need to understand, okay, why is the immune system unable to manage that? And yes, I have seen Epstein-Barr virus trigger Hashimoto's after a mold exposure and reactivation in myself. I had thyroid antibodies, and my I don't think clinically I would have quite fit Hashimoto's, but I was definitely headed towards that way. And I see if somebody has Hashimoto's or an autoimmune condition, that's just something that I check. I'm like, okay, well, let's see if you have a high Epstein-Barr virus load. And there's other viruses too that can be involved. We have a pretty good way of testing for Epstein-Barr virus, but when Epstein-Barr virus is positive, I think it's important to remember that there could also be other viruses. If that one you're susceptible to, then you could also be susceptible to cytomegalovirus and other herpes family viruses as well.
Yeah, I feel like Epstein-Barr virus gets a lot of attention, but there's other viruses too that can be problematic. I know there's been a lot of research in this direction. 2015 Polish study found Epstein-Barr virus in the thyroid cells of 80% of people with Hashimoto's and 62.5% of people with Graves, and controls did not have it present in their thyroid glands. And it was like suggestive that there was like a proliferative state. So it was like a slowly growing infection within their thyroid glands, which I think is really, um, really something to pay attention to. And of course, similar studies haven't been done for other viruses. But, going back to like, why is it a problem for some people and not for others? One of the things that I noticed when I started working with clients is some of them had a really high degree of like a protozoal parasite, Blastocystis hominis, not something you would see like a parasite cleanse and you'd see like these, wiggly worms or anything. It's not something you would see with your naked eye. So you probably don't know that you have it unless you were to do like a test, a stool test for it. Symptoms might be like hives or IBS, but it's been connected to Hashimoto's antibodies as well. And some of my clients, I remember like looking at their timelines and it was like the Epstein-Barr virus, they had it and they never quite felt the same after. And they were trying to work on the Epstein-Barr virus. And I would be like, oh, wait, you've got this weird thing on your stool test. Let's see about treating that. And then their like Epstein-Barr virus would go into like the dormant state. And I'd be like, huh, how did that happen? And there's like various things that can really, and like my theory is that it that suppresses your different parasites can change your immune system and your immune cell expression. We definitely know that it can change your gut immune system. And there's various things like that that can actually make it so you have a harder time fighting and suppressing the viruses. I know mold is notorious for that, right? What are some of the other things that you see in your practice where you're like, okay, you're struggling with Epstein-Barr virus, and we need to actually dial in some of these other things, potentially in addition to tackling the Epstein-Barr virus like directly head on, right?
Yeah. So parasites is I'm so glad you brought that up because that's a huge one with Epstein-Barr virus. We have different forms of our immune response. There's a Th1 and a Th2, and parasites cause an imbalance in that. And really, since Epstein-Barr virus is in our body, if we have a sudden shift in our immune response or the way that our immune cells are patrolling around, then that makes us really susceptible. So, if somebody has parasites, I see EBV be really common. And then if somebody has parasites, usually it's either, okay, they were traveling and they, ate something, but there's people that have lived in the United States their whole life, haven't traveled outside of it, and they still have parasites. And then they are always so surprised when their stool test is positive and they're like, how did I get this? Well, sometimes this can be, I mean, it can be from eating sushi, it can be from eating salmon, like parasites are they're around. But the other thing is it can be a sign that there's a heavy toxin burden because a lot of times when we have dysbiotic bacteria, parasites, or gastrointestinal things going on, is what the microbiome is trying to do is clear out toxins. And those imbalances are actually there because of a high toxin load. So you brought up mold. That is one of the number one things I have so many patients that come to me because they've gone to all these doctors, they've taken every supplement for Epstein-Barr virus, and if anything, they feel worse. And I've seen it enough now that I can kind of just tell when somebody's mold sick, also because I've been through two really horrible mold illness experiences myself. It's like I can just feel it. But mold is really, really hard on the body. It causes a very strong increase in oxidative stress. And when I was researching, like, okay, what triggers Epstein-Barr virus? It would be like, there's an article on this, there's an article on that, on this infection, on this parasite, on this toxin. I'm like, what do they all have in common? Well, they're all causing oxidative stress in the body, which just everyday life, stress, emotional stress causes oxidative stress in the body. It really just means that there's more reactive oxygenation species being produced in the body than our antioxidants that clear it out can keep up with. That's how we age. That's how a lot of health conditions are formed. And when that level is really high, there is a kind of a switch with EBV where it interacts with different proteins. And so people are always like, how does EBV like know when to turn on? And it kind of feels like that. But there's actual mechanisms here in the body that do that. So oxidative stress levels, mold creates a very high, very intense oxidative burden. And then also, mold can interact and impact the body's immune system, specifically the B cells, which are typically what are involved with Epstein Barr virus. It's like they don't remember it anymore. So, a lot of times when we see that IgM go positive or stay positive longer than it's supposed to, or even the EBV early antigen stay positive for a very long time, something like mold is often at play. And there's other toxins like glyphosate. Think of how much it is linked to lymphoma. I really want to see a study on people with lymphoma exposure to glyphosate. What's their EBV level there? I don't think it's just the glyphosate. I think that they probably also have infections that turned on. So it's never just Epstein-Barr virus. I've really never had a patient that came in and we were like, "Oh, you just have Epstein-Barr virus." I've never experienced that. If you have, let me know, but I haven't. Um, but when it is turned on, it for sure, it's like pouring gasoline on a fire. Everything just turns on and you feel awful. But other things, other toxins too. So heavy metals, pesticides in general, uh, and then of course gastrointestinal health. There's actually a study done on candida and antifungals, oh excuse me, antivirals, where they checked to see how effective the antiviral was when the virus was also with candida, so mimicking a biofilm, which happens a lot in our gastrointestinal tract. And the antiviral was not as effective against, this was not against Epstein-Barr virus specifically, it was against HSV 1 and 2, I believe. But still, that's the same family of viruses, and the antivirals were not as effective with the candida there. So even that alone, sometimes somebody hasn't been exposed to mold, but maybe they have, candida is also an opportunistic infection. So maybe they were on oral contraceptives for a really long time or standard American diet. Who knows? Candida is so common and they can't clear that infection because of that being there. So that's another really big one that I see. Um, I think those are the top ones. Yeah.
Thank you for sharing that. And I think I've seen people with, I want to say, methylation issues where we've provided some methylation support and that helped to get Epstein-Barr virus in check. I know somebody was put on a medication, and I'm trying to remember which medication it was. It's where that caused them to have a reactivation of Epstein-Barr virus. I feel like, nutrient deficiencies, you could be related as well. Is that your? I think that it was through. basically the medication caused the nutrient deficiency, and then they ended up essentially reactivating. Have you seen that in your clients as well?
One medication that comes to mind a lot would be like fluoroquinolones, um, because of, again, I think it's the oxidative stress a lot that happens to nutrient deficiency could definitely also impact that. Um, and I think that sometimes antibiotics, like we think, oh, they're going to disrupt my gut microbiome. But when your gut microbiome is disrupted, if it's severe enough, then a lot of times you're not absorbing as well in your small intestine. So nutrient deficiencies, can be very prevalent. And a lot of times nutrients, if you think of vitamin C, we only get that if we consume it. It's a water soluble vitamin, and that is one of our biggest pieces to helping keep glutathione levels up. It's an antioxidant on its own. So if we don't have that, another one that is common, which goes a lot with thyroid too, is selenium. And selenium also in, so glutathione can be recycled. Unlike vitamin C, we have to consume more vitamin C, but glutathione can be recycled. And zinc and selenium and vitamin C all help in this process, as well as vitamin E. So if you're not absorbing and you have a stressor, and then you can't recycle your glutathione, which is our body's master antioxidant, then you're very susceptible to EBV reactivating.
I think that makes a lot of sense. I've also seen some studies on like COVID, when people have long COVID, that a large percentage of them have Epstein-Barr virus reactivation. And then I know there were some healthcare professionals talking about like how strep and Epstein-Barr virus oftentimes go hand in hand. I'm curious if what's been your experience with these other types of co-infections?
Yeah, strep and EBV go hand in hand, especially in kiddos. If a kiddo has strep and they're getting it over and over again, and then they test them out, oh, you have mono. Strep can, like, parents are kind of just told about it being on the tonsils. Oh, we'll swipe your tonsils, give them antibiotics, but it can also then be in the gastrointestinal tract. Our it's a whole system. Like the gastrointestinal tract doesn't just end. It comes up your tonsils. Everything is a part of it. So strep can still be in the gastrointestinal tract, and then it's a very common age for kiddos to get strep and mono at school, and then they have this chronic mono. So a lot of times we will check the ASO titers, which are anti-streptolysin titers, or do a stool test. So we see that a lot. COVID, yeah, that we could talk so much about that. So it's really interesting. First off, I think we need to also just keep in mind that the flu can do this too. It's really any viral infection that hits your body hard, because infections can also cause increase in oxidative stress. So if you're depleted in antioxidants and you get the flu, or you've been really stressed out, we'll have to talk about the adrenal response too. Yeah. But if you're susceptible and EBV reactivates after an infection, well, COVID was a severe flu, is a severe flu, and it really disrupts the immune system's regulatory system. We still don't have all the answers about what exactly is happening, but more and more research is coming out. And when I have talked to other colleagues, it's like, oh, yeah, people that didn't know they had mold and were okay got COVID and then were mold sick, because that part of the immune system that was regulating that is no longer regulating it well. Same thing with EBV, is same thing with, maybe gastrointestinal health. Like long COVID, there's so much under that umbrella. It's not just fatigue. There's patients that have crazy anxiety that don't sleep. There's people that have all of a sudden irritable bowel. It spans so much. But one thing that was really, really interesting to me was people that had had COVID, and some of my patients had Lyme disease as well, or other infections, chronic illness things. So they had actually started ivermectin because they were concerned about getting COVID and wanted to try and decrease the effects. And they got better after they had COVID. They're like, I feel better than I have in 10 years. And I would be like, oh, okay. And probably they had parasites. Ivermectin also off label interacts in a very positive way with inflammatory markers and cytokines. So there's that. But they probably had these other infections that they knocked out that they didn't even know they had. So I think with COVID, really what you have to do is you have to look at everything all at once and you have to treat aggressively all at once. The longer somebody stays sick in a long haulers or long COVID presentation, the harder it is to get them well because it's like a snowball. When one inflammatory marker turns on, it turns on another, and then another. And then you're exercising less because you're exhausted and you don't feel well. So your lymph isn't moving and your immune cells aren't circulating. It just snowballs. So we have to really go really wide when we look at that.
Hmm. Thank you so much for sharing all of that, and thank you for sharing about ivermectin. I remember, I'm a trained pharmacist, right? And so there's this whole body of off-label medication use, and medications aren't just like this does that. Like they have like, there's like really broad mechanisms of action on how they impact things. And I was just like appalled at like the media being like, people are using horse dewormers. And I'm like, okay, I've dispensed this to humans like in my past pharmacy career, and it's used off label for things like rosacea. And I just feel like it's gotten such a bad rap, and people, I guess, have been so closed minded about it where they're like, oh no, why would you use a horse antiparasitic? And I'm like, if you take the time and look at the pharmacology, it's got like a really broad application of use. And anyway, little pharmacist tangent here.
I bet that was really difficult for you to watch. I know it was for me, but it's been used for a really long time and it's also got a pretty great safety profile. So that was pretty wild.
Yeah, it's been a crazy last few years. Throughout that process, I'm always like, okay, there's so much going on and so many things we don't know, so many nuances. One thing that we can always do is support our stress response. And I know I had to personally get really good at that during the pandemic. I have a now 6-year old who was like 2 at the time. So stress we know can really suppress our immune system. And of course, having chronic illness can be very, very stressful. A big part of what I do with most people with Hashimoto's and hypothyroidism and any kind of fatigue is supporting their adrenals and really focusing on, like there's ABCs of adrenal dysfunction. So adaptogens, B vitamins, vitamin C, really doing pleasurable activities, supporting the mitochondria with some mitochondrial support. And a lot of times, like, I feel like when you do things like this, it actually makes um, treating the infections a bit easier for people too, because once their immune system is properly supported and they're sleeping better, it's like they can actually fight these um, viruses, easier. Can we chat through about that? I know you had mentioned adrenals, and I'm like, yeah, really need to talk about the adrenals and how they relate to, or just stress in general, how that relates to just chronic illness and chronic viral burdens.
Yeah, I think that suboptimal adrenal function and thyroid function is oftentimes something that'll make or break somebody healing. And sometimes their problem is not so much the virus as much as it is that those are both not operating suboptimally. I have a really incredible mentor, Dr. Paul Anderson, and he always talks about how if you're supporting the thyroid, you got to be supporting the adrenals. Like they work together. You have signals from your pituitary to your thyroid and your adrenals. That whole thing is connected. The interesting thing about the adrenals is I really think that sometimes patients have what might not be considered Addison's, but is so suboptimal that their fatigue symptoms and joint pain is more adrenal related than the virus, and that's why they can't clear the virus. So your adrenals, they're little glands located above your kidneys, and they secrete glucocorticoids, corticoids, can't say that word. When you wake up in the morning, that spike of cortisol is literally what wakes you up, what turns on your immune system, what helps your thymus filter immune cells. So if that is not working, and I see so many patients come in, we do a salivary cortisol curve, there is no morning spike. They're just flatlined and they have joint pain and their hair is falling out. They have low sex hormones. They are fatigued all the time. That can all be from adrenals. It can also be associated with Epstein-Barr virus, and Epstein-Barr virus definitely causes those symptoms and makes that worse too. But I see patients taking, 20 supplements to try and kill this virus, but no adrenal support. And the adrenal portion, like you were talking about, it's so important. And there's so many things that we can do, like you said, with B vitamins, vitamin C. Sometimes people do need low dose hydrocortisone or something to actually have sufficient. But the problem is that, especially in conventional medicine, if you don't have Addison's disease, it's just like you're fine. There's nothing that we have to do. Thankfully, adrenals are pretty resilient and they will heal. But one thing that then comes into play, which I love you said, is like we have to have you doing things to help you de stress. Sometimes people are coming out of a traumatic situation or have just been, running running at both ends, the candle burning, burned out for the past 5 years, and they think they can just keep going, and their body finally says they can't. So we have to regulate the nervous system and give the herbs, the adaptogens, the B vitamins, sometimes glandular or a pharmaceutical to give those adrenals the support that they need. Literally nothing, your thyroid, infection response, nothing is going to work right without that response. Is that what you see too?
Yeah, I mean, absolutely. And sometimes it's like just a really, really solid plan of focusing on your adrenals for 4 weeks. And you're focusing on better sleep, maybe doing some gentle trauma therapy, neurofeedback, depending on the person, it might be a little bit more intensive, but I find like pleasurable activities, magnesium, Epsom salt baths, like all of these things can really shift your body and your immune system where it just becomes more resilient and we're gonna get into, like, the herbs and all of the direct ways to treat Epstein-Barr virus. I'm really psyched about that, but those things just work better, right? It's like when you are, coming with this, I guess, balanced, immune system and your immune system isn't so suppressed, and it's just so fascinating because sometimes I think common sense would dictate like this comes up positive on a test and you directly treat it, but sometimes it's like treating the things around it. That's been like my weird experience in functional medicine and working with clients. Sometimes it's like there's this thing that is like, okay, this is the glaring issue, but sometimes it's like you treat the things around it and then this really hard glaring issue isn't so hard anymore. I know some people are like, "Oh my gosh, like I have Epstein-Barr virus, like, am I ever gonna get better?" And a lot of times I know, sometimes it just takes, like, dialing in a few different things for you to actually feel better, and if people listening, like, there is absolutely hope, and perhaps you just weren't, like, you know, maybe you were looking at the different part of your body that you need to support because the body's like viruses don't exist in a vacuum somewhere or like in a petri dish. Like they exist in our bodies, and we have to think about all of the different aspects. So we talked about some of the root causes and triggers why people might have this reactivated Epstein-Barr virus, and we would want to dial those in. I think we covered that, but is there anything else that you would want to add to that before we move on to more of the direct strategies?
Yeah, I think I would just say, um, I know we touched on this with Hashimoto's, especially with your specialty there, but really for anyone listening that has an autoimmune condition, the thought that you just have that autoimmune condition and you might be on medications for it, and that's just almost becoming your identity for life is kind of what conventional medicine can do. And you should be worked up for everything that we're talking about because when we deal with this, then autoimmune conditions can be reversed and can go away. So I just want to send that message out there because so many people feel like once they get that diagnosis that there's no hope.
Thank you so much for sharing that. I feel like I feel the same. It's like when you address the root causes and the things that, the dials that are out of balance, when we kind of get them back into balance, like the body can reset itself and it can, the immune system can start working really well again. Okay. So I've looked at some of the studies for antiviral medications, and I know this is one approach of using antiviral meds to address Epstein-Barr virus. I want to say it was either Valaciclovir, trying to remember which one it was, that if you took it long enough, it could potentially remove Epstein-Barr virus from your body. But I don't know that, I don't know that I've ever seen that. Like, what is your experience with utilizing perhaps antiviral medications or herbs? Do you use them for like the reactivated Epstein-Barr virus and you kind of get it back to unreactivated or suppressed? Or do you see using them for time periods can remove the Epstein-Barr virus from the body? And do we actually want to remove it from the body? I guess is the conversation. Because I feel like people are like, well, once you have it, you always have it, right?
Hmm. Yeah, I haven't seen that it can actually remove it from the body, but I do use valacyclovir pretty regularly. The key is so I have had patients that have been sick and they just really want that quick fix. Like they just want to take the antiviral, get their life back, which I don't blame them. Like they want to feel better, but they haven't wanted to do some of the other things like lower oxidative stress, increase their antioxidants, um, build up their adrenal glands, and hone in on lifestyle things, make sure that they're getting enough nutrients, sleep, and things like that. And also, I would say these patients usually have another toxin involved where we need to do a lot of drainage and removing that because when you take valacyclovir and we're killing the virus, we're interrupting its cycle so it cannot replicate. Your body wants to remove that. We don't want it just sitting around gunking up. So if you're not moving, if you're not hydrated, if you have other toxins like mold or heavy metals or whatever, some people will feel really worse when they take it. And I've had this happen a couple times and it's like, okay, we got to work on like you're talking about all the things around the virus, not so much the virus, and then we can try again. Um, and then other people where it takes time as you know. I mean, if you've been sick for 10 years, it we need months working together to figure everything out. And when we address all the things around the virus and then add in valacyclovir, I actually had a patient just a couple weeks ago, and she was so excited for our visit because she was like, I actually feel better. She had been to chronic fatigue syndrome clinics like Mayo all over. And she had tried other antiviral therapies. There's some that are more associated with HIV that they're trying. And she felt awful on those ones. And so I think also that she didn't say this, but I think she probably was a little nervous to try the valacyclovir because she felt so awful on the other ones. But we added that in after probably working together for 6 months on other things as well as mold. And she felt great. So it is a tool. It does work. Valacyclovir was traditionally made for herpes simplex virus, but EBV is from that family. So we're technically using it off label, although there is some starting to be some research coming out on it. Um, and typically, though, also you do need to stay on it long term. Um, some people it's 3 months, some people it's a year. And so then the other thing is it's a pretty safe pharmaceutical, but there we still want to be supporting your liver and kidneys. It's a something we're introducing to your body. But yeah, it is effective. Botanical medicine wise, I think can be very supportive. Olive leaf has great research on it regarding antiviral activity and is very often used. One that I use for all the things around EBV, and kind of there's not really research specific to Epstein-Barr virus, but there is for antiviral activity and for building up white blood cell count is astragalus. Astragalus is also an adaptogen, and an adaptogenic herb means that it kind of shapes into what your body needs. It's not like a pharmaceutical where it has one or two main actions. It has multiple benefits. It also is anti inflammatory. So I really like it for kind of addressing all of the inflammatory pathways that EBV can turn on. Because when somebody has reactivated Epstein Barr virus, is what I am thinking is not just getting rid of the virus, but preventing an autoimmune condition, or it is associated with cancers as well. Um, the other great thing about it is it's very nourishing to the adrenal glands. It is not stimulating like some herbs like Panax ginseng are very stimulating to the adrenals, which for some people that's what they need. But for a lot of these patients that are very fatigued that come to me, we can't overstimulate their adrenals because they don't have anything to stimulate. So something like astragalus is very tonifying. It can be taken long term, and it works in synergy with other things. So those are two of my favorite herbs that I think also have the most kind of evidence based research behind them.
I love astragalus. I love all kinds of adaptogens. Thank you so much for sharing those. I love astragalus. I also have found lomatium to be very helpful for a variety of different herpes viruses. The only thing that I don't like about it is that in some people it can cause a rash. Um, I know that's like the last thing you want when you're trying to deal with like one chronic health issue is like getting a rash. But I've used that in some of my clients and they found that to be incredibly helpful. Um, Beyond herbs, there are things like high dose vitamin C and ozone. Can we talk about some of those therapies? Do you work with them in your practice? And what's been your experience with them?
Yeah, I really like high dose IV vitamin C. Um, it's great because we have published research showing that it lowers antibodies to Epstein-Barr virus. The other nice thing about it is that so there's a difference between IV vitamin C and high dose IV vitamin C. I love that IV therapy is available everywhere on every street corner now. But when you get an infusion of vitamin C, say it's like 5 to 10 grams, that's fine. That's very beneficial. It's immune supportive. It's an antioxidant, great, but it's not high dose IV vitamin C. So high dose IV vitamin C, you have to have a specific blood test drawn first called G6PD to make sure that your cells are okay with how they handle it. Um, and it is considered dose of 25 grams or more. And when we get to this level of dosage in the body, it's going to have an oxidative effect. Now, remember, we were thinking oxidative was bad, right? Well, this oxidative effect is used to kill the virus. And then on the back end of it, you're also going to have the vitamin C as an antioxidant. So it's going to help with recycling glutathione, all of that. So I really do like that therapy and think it's very effective. Again, we have to make sure all the other things are going. It's similar to the pharmaceutical antiviral. If we haven't dealt with your detox pathways and all of that, you can feel worse after it. The ozone, I don't use this as much, but I have had people use it. It is very oxidative. I like to use it kind of more at the tail end of things when we've really built up the adrenals, make sure the thyroid's okay, make sure toxins are out there because I mean, it can be antifungal, it can be all these things. And so, is what I've seen happen is somebody that is in mold and is just treating EBV, they think they're going to do ozone and it fixes everything. And they feel really, really awful. So, it's powerful stuff. I love it, but I think it just needs to be used right. And sometimes you need to just do a lower, slower dose. There's different forms of it and different concentrations. You can do different amounts of passes where there's newer machines called EBU, where it's literally like the ozone's just going through your blood, throughout your body. Another favorite therapy of mine is photobiomodulation. For my patients, it looks like a little watch, but they wear it on their wrist. And there's red, yellow, green, and blue light that goes on their radial and ulnar arteries. So their blood is circulating under that light. I like this because it's really not invasive. There's also actual photobiomodulation with a catheter where the light is actually injected as a needle and the blood is going through. And the different colors of light can be for different things. So, for example, yellow is really great for viruses. Green is great for boosting the immune response. Red, think of red light, infrared, all that spectrum. We know it's great for cell repair. So this device, I can turn on red, yellow, green, blue all at the same time, or I can do red and green. And the other thing is that light, oh my gosh, I love light. I think living in Alaska made me really realize how much you need it for healing. But it can photosynthesize things. So I can have somebody take liposomal curcumin while they do this light therapy, and the curcumin is going to be more active in their body. So a lot of people, if they can afford it, I suggest them getting this device, doing it at home. But curcumin is another big thing that I use because of its action against the NF kappa B pathway. So we use curcumin to prevent all sorts of inflammatory. It's really in the alternative world used for autoimmune conditions, cancer, as just a baseline to help with healthy inflammatory levels. Um, but I think that the light therapy and the vitamin C are my favorites.
Thank you so much for sharing about that because I feel like sometimes we can hear about these amazing therapies like ozone and it just works so well. And we can jump into them before we're ready. And rather than utilizing their healing benefits, we can actually have these adverse reactions. So I really appreciate you talking about, let's do these other things first. And also tell us about this light therapy device. Where do we get it? I'm like ready to add this to my cart. I haven't heard of this before. So
I love the Endolight. You can go to Weber Lasers. I can send you a link there's a link on my Instagram profile where it says at home laser devices or light devices, and it's there. Uh, I believe that their products are made out of Germany. That is my favorite. Like, I love it. They also have red light mats. I also have a helmet of theirs for people with a lot of brain fog and neuro neurocognition problems post mold Lyme EBV, and you look like you're wearing a bike helmet. But their products are really great because there's so many red light products on the market right now, and these have been clinically studied to see, is this wavelength right? Is it getting to where we want it to? And so that's really important to me with patients, is making sure that what you're investing in is able to do what we want it to.
thank you so much for sharing about those. I will definitely put the link in the show notes for that. Um, okay. There are some other therapies out there that have been suggested for Epstein-Barr virus, maybe some. I know when I was first diagnosed with Hashimoto's, there was like coconut oil had its moment. And so I was like, let me rub coconut oil on my thyroid gland. Let me take some coconut oil. Can we speak to that? How helpful that might be for somebody with Epstein-Barr virus?
Yeah. Well, I think for EBV, a lot of times the loricidin, which is from that, is used, and I see it work well in people that have what I call more of an acute presentation, where they have mono for the first time, or they really did just have a very stressful event and they're EBV reactivated, but physically we don't have a high toxin load and things like that. In those cases, it can be helpful, and so can lysine, especially if somebody has HSV1 or HSV2 and has the cold sores. But outside of that realm, where we have somebody that's been sick for years and years, I've seen people take it and take it for a long time and nothing changes. And so it kind of depends on, where you're at with that. Another thing that has been really beneficial and I think is very underappreciated is infrared sauna, especially for Hashimoto's and thyroid, because your thyroid has to work so hard to control your body's homeostasis and everything. So if you have the virus and you have a sluggish thyroid, hopping in that sauna, just supporting your body's core temperature alone can really help people with the fatigue. There's all sorts of other benefits too when we get to talking about circulation and moving toxins to the liver to move them out and reduce your overall toxin load, as well as it has benefits for regulating heat shock proteins, which can be associated with autoimmune conditions. Um, but I think that's very underappreciated too.
I just love sauna and I love it for so many things. Definitely for people with hypothyroidism, Hashimoto's, it makes so much sense. I mean, people, I always joke that like the one symptom that is like almost everybody has, but nobody wants me to help them get rid of it is like lack of sweating. When you're hypothyroid, you're just not going to sweat that much. And we really clear toxins through our sweat. So sauna can help you do that. And then, when we're raising our core body temperature, that definitely is helpful for the immune system. When you think of somebody having a fever, that's helpful for fighting infections. And just people feel amazing um, after sauna sessions. And definitely, if you're somebody that's like listening to this and is like, well, I feel awful after sauna, but these two said I should do it, then um, listen to your body. Don't necessarily listen to us, but it's one of my favorite things to use for hypothyroidism. So thank you so much for sharing with that. And I love that it can help with EBV as well. People talk about like that lysine and arginine balance with Epstein-Barr virus. And I know there's like benefits of arginine, and you're supposed to like have low levels of arginine when that's one of the like the diets that's been proposed. Could you share more about that and your thoughts and what you've observed?
Yeah, I see having low arginine diet really help with the cold sores and HSV1, HSV2. Um, I don't think that it hurts to keep that in mind. Like, let's not eat, a chocolate bar when we're sick or things like that, and try and kind of keep arginine lower. Be mindful of lysine. Be getting that. But I haven't seen it move the needle. Like, I don't think that for patients that are really not feeling well, really sick, that just following a strict diet alone and is going to move the needle. Now, I will say a healthy whole foods diet is incredibly important for healing and is foundational. But I just have seen people do very severe diet changes and expect that to make them completely better. And that has caused a lot of stress, which, oh, I can't eat that, da, da, da. And that stress is is just as toxic as, oh shoot, I had a little bit too much arginine today or whatnot. So I really think it's just important to keep that in moderation. And I think it can be a helpful tool when we're, trying to optimize everything that we can to get somebody feeling well. But I haven't seen that make a huge difference in patients, except with if somebody also has HSV1 and 2, which happens a lot, that can be really beneficial for decreasing outbreaks of the cold sores.
Thank you so much. And I'm with you on that. I feel like nutrition and diet is so important and it can be a part of the puzzle. But sometimes when people over focus on that as their only like healing strategy, that can really set them back. Um, Another kind of trendy thing, celery juice. Will that get rid of somebody's Epstein-Barr virus? How do you utilize that in your practice, or what are your thoughts on that?
Yeah, celery juice, it has a lot of minerals, which some people, if you go from eating breakfast where you're eating, like a McDonald's takeout breakfast, and then you switch to celery juice, you're gonna feel better. For sure. And it has a lot of healthy minerals. It can aid in digestion, but it doesn't actually get rid of the virus. And some people have added it in and haven't had benefits. It doesn't mean it's not good for you, but also I will say moderation, because celery juice, when we are drinking just that, I've had people come to me and they've just really thought that if they drank enough celery juice they would feel better, and so they drink so much of it that they're increasing their oxalates, and then they're having joint pain or kidney irritation. And so again, it's a moderation thing, and it's not something that is just a end all be all.
Yeah, and I agree with you, and especially people with candida and mold issues, that's gonna cause you to produce oxalates internally, and then you get on that celery juice, and that can make things worse. And I love all kinds of juices, and I love coconut oil. Like, I'm so glad I added it into my routine. But spoiler alert, coconut oil did not cure my thyroid condition, right? I love it, but and I love celery juice, but unfortunately, I feel like people see this, and same for thyroid conditions. They're like, "Oh, I just need to like throw away my thyroid medicine and drink celery juice." And I'm like, "Please don't do that, because yes, juice and nutrition, it's so good for you. And again, moderation, but let's like look at all of the modalities that we can use to support you, because oftentimes you need more than one. It's like it can be a combination of hormones and medicine and herbs and nutrients. And yes, yes, add the juices if they make you feel good, but please don't throw your thyroid meds in the trash.
Yeah.
So I feel like we're on the same page with that, and I think that can be tricky because I feel like people do I don't wanna take away people's hope, right? But I do wanna offer them, like, realistic
Mhm.
solutions, and actually, like, addressing all of these things
Mhm.
is what can help, right? And it's generally not gonna be, like, one thing.
Mhm.
Is it true that Epstein-Barr virus is passed to the child in pregnancy?
I mean, we don't test babies for it, right? Because we don't want to poke them. So, do we have a lot of clinical evidence saying, yes, um, this is passed? No, we don't. Is it possible? I think it very much is possible because it's passed through bodily fluids. Um, it's more thought of with saliva. So is it possible that your baby isn't going to get it till later? Yeah, because most people get it from school or passing. So whether the virus they were exposed, but it was, very minimal, and so the baby wasn't sick, and then they got it and had their first immune response. But passing it to the baby isn't something that, like, it's not something that I worry about a lot, because I think we would I mean, unless we're just missing it clinically because we don't test babies. Now, if a baby is really sick or has unexplained fatigue or, abnormal liver function or something, then I think it would be warranted to look into that if the mother has, a history of it. But I have a lot of people that get concerned about, am I contagious with somebody like my husband? And I'm like, well, he's probably already been exposed. So I don't want to scare people about that either.
Thank you so much for sharing that, and I don't know if this is a myth, but I remember reading reading an article and it was like, I don't know if it was a hypothesis journal or something like that, but they talked about how you might actually have better outcomes if you get Epstein-Barr virus younger than older. Do you think that there's some truth to that? I know personally, like I got it in college, and some of my clients have been like, I got it in high school and college, and that's when I felt awful after that. What are your thoughts?
I think that so with chicken pox and shingles, when you get that younger, well, usually you don't get shingles younger. So I would say chicken pox, it's usually more mild. I haven't read that research. I'd love to see it, but it makes sense to me, you know?
Thank you. I'll have to, like, track it down now and send it. Sometimes I just read a lot of stuff, and sometimes it's, like, medical hypothesis or just somebody's hypothesis, so thanks for sharing that. Zinc, does that play a role in preventing Epstein-Barr virus to reactivate?
Zinc is really important for overall immune function. So you definitely don't want to be deficient in it. It's pretty rare to see outright zinc deficiencies unless you have some absorption problems because it's pretty available in food. So it is important, but is what I why I say that is I don't want people to just go out and start dosing zinc because I've had patients come to me, especially through the pandemic, where they were high dosing zinc for over a year. And then all their other minerals are kind of off, and the zinc copper balance is so important. So, usually we use zinc for an acute, like if you're in an acute flare up or you've got the flu, that's when we high dose it. We don't want to high dose zinc. So, if you're taking a high quality multivitamin, you're most likely getting enough zinc unless we have other things going on or imbalances or absorption difficulties.
Hmm. Thank you so much for sharing that feedback. I know definitely zinc can impact the copper levels, and sometimes if somebody's copper toxic, that's a good thing, right? But if they're low in copper, then that can just be really problematic, and so testing zinc and copper, I feel like, is one of the good things to do if you're gonna be on something longer term to make sure you're treating yourself correctly versus just popping high doses, right?
Yeah.
Okay. Question: if somebody has cold sores or the feeling often of one coming up, does that mean that they have Epstein-Barr virus reactivation too? How would you approach that? Would you encourage them to investigate that? Because can Epstein-Barr virus make other viruses more likely to impact, right?
Yeah, that would mean the HSV1, which is a herpes family virus, is active. And if you're also having fatigue, then it would be good to get EBV checked because those viruses oftentimes are positive at the same time.
Thank you so much for sharing that. I think that's great advice for people. Anybody that's really been struggling with their fatigue and health, I feel like looking into this is going to be really, really important for them. I know, Dr. Kasey, I would love to keep you here for like the rest of the day and just pick your brain a bit. I
Well,
really,
you have a busy day. You have other people to talk to.
yes, I do have a little bit of a lunch break, taking care of my adrenals and all of that. But it's been so wonderful to have you here. I know people are asking where they can find more about your work, and if they could work with you. I would love for you to share that before we go into the fun rapid fire questions.
Yeah, you can find me at drkaseyholland.com. And uh, there's there's information on Epstein-Barr virus there. There's where you can see what services we offer. And then I'm also pretty active on Instagram, although not as much the last 6 months. I just had a baby, so kind of haven't been as active there. And then I have a YouTube channel and Facebook page. It's all Dr. Kasey Holland. And there's quite a few resources, a lot of posts about EBV there.
Thank you so much for educating us about this. We really appreciate it. And then you have something called the Freed method. Can you tell us more about that?
Yeah, I started that this year. And really, it's for people that are fatigued. If they have Epstein-Barr virus or not. But really, it's the method where we're looking at everything that we're talking about. So it is not we're just killing Epstein-Barr virus, but we're looking at what's going on in the body. And also, in that method, I like to do an oxidative stress test. You can measure oxidative stress through 8-HDG. I'm not going to try and pronounce the whole name. I always butcher it. But lowering that, which I often see high with EBV, can increase your whole longevity. It can make you feel better now. It can impact when you go through menopause. It can impact how you age. And so the Freed method is really trying to eradicate fatigue. And Epstein-Barr virus is obviously built in there. But we're kind of just looking deeper at really optimizing someone's health. And fatigue is so common. I mean, it is so common in our society. And I just don't think it should be considered normal because a lot of times it is. So that's what the Freed method focuses on.
Thank you so much for creating this. I'm excited to check it out. So I know that a lot of us can really benefit from this information.
Yeah.
And I know it took a lot of work and probably blood, sweat, and tears to put that together.
Yeah. Oh, just being sick myself, right?
Okay, thank you so much for sharing that. And people can, I'm going to put the links to Dr. Kasey's website in the show notes. Let's do some fun rapid fire before I let Dr. Kasey go. Okay. Are there any wellness hacks that you refuse to participate in?
I guess celery juice. I will drink celery juice on occasion. Like I'll have celery juice if I want to have some celery juice, but I'll, I just don't typically do hardcore diets. So I would say diets in general, fad diets, things like that.
Yeah, thank you so much for sharing that. I haven't done like a celery juice thing either. I did try like a general juice cleanse for 3 days, but then it was supposed to be 5 days. But then like I started getting ads for my favorite restaurant doing a pig roast. And so at that point, I thought it was a sign from the universe that this wasn't for me. And so definitely I feel like, to each his own, we have to do what we feel is best for
Mhm.
us. Not to diss anybody that loves celery juice and feels great on it, right? Or juice
Yeah.
cleanses, but definitely not for me either. Perhaps the most outlandish thing you've tried for your own health?
Hmm. Huh. I mean, I've done kind of all the things. I don't know if I would consider them outlandish.
It's a slippery slope when you're like in the functional medicine. Because I know I used to think like doing a stool test was outlandish at one point, right?
Yeah. Yeah. I'm just going to go with ivermectin because of how the world has viewed it. But I had pretty bad long haul COVID. I
Mm.
had been living, we didn't know there was mold anyway. There was reasons that it was really hard on me, but basically mold exposure, EBV reactivation. And I took ivermectin and felt really, really amazing. And at that time, it was when it was very controversial. I was nervous to take it, but I felt amazing on it. So I'm going to go with that.
The amazing thing is you're not even a horse, right?
Yeah.
Yeah, I could see why that would have made you nervous with all of the media information out there at the time.
Mhm.
Um, And do you have any kind of guilty pleasures that maybe aren't like doctor approved? Somebody would be like, is that Dr. Kasey Holland? Is she really doing that?
You guys, I love chips. Like giving up chips. I try to do carnivore crisps and things.
Not the
Or
same.
right now we'll do like the Siete chips, which I know Siete was just bought by someone else, but it's avocado oil. So it is, better. But I mean, like going out to a Mexican restaurant and just having a bowl of chips and salsa,
Yep.
like, yeah.
How to live life. I know I used to live in Boulder and the Boulder chips are pretty tasty.
Oh,
And so
yeah.
get those, but every now and then if I'm like going somewhere on a trip or I'm flying, I just like to get like a bag of Lay's chips and eat that. It's like so salty, so it supports my adrenals and it's like kind of the only thing available at an airport. And like a couple of months ago, I saw some like a colleague and they were like, Isabella, is that you eating Lay's potato chips? I would have never thought you would do that. And I'm like, what? It's me, guilty.
Yeah.
So, um, what's one health myth that drives you absolutely nuts?
Hmm. Um, I think just functional medicine in general right now is a tricky spot. A lot of people think that they've had an experience where they've paid all this money and they did a functional medicine test, and then you take, these 5 supplements and you're going to be better. To me, it's kind of like this green allopathy that is happening where it still is this mindset of I take a pill to get better. And I use pills, they are helpful. We do need them to overcome obstacles to cure. But I think a lot of people are just so hooked on if I get the right protocol, I'm going to heal. And there's so much more to healing than your protocol. You really need to have sleep and hydration and a provider that is walking with you. And right now, it's just difficult for providers because everybody's really busy. But I'm just really hoping that we can connect with people like this and open up and get rid of this. I want this magic pill. I want it now. And that health is um it's like a balance, and it's a lifelong journey. It's not about doing a protocol for 4 weeks and then going back to sleeping only 4 hours per night, drinking vodka, and feeling great. Like it just doesn't exist. You can't do it.
Yeah, thank you so much for sharing that because I think a lot of times the foundational things are sort of ignored and missed. Like, obviously, not drinking a half a bottle of vodka is like going to be helpful for your health. But some people are like, oh, I just want to take the pills and still do a lot of these toxic things. And sometimes they're not even food, it's just like the behaviors, like, overworking, overtraining, having like negative thought patterns that can be part of what really can keep us stuck, right?
Yeah, exactly.
Yeah. Thank you so much for joining me. This has been an incredibly insightful conversation. I really enjoyed the opportunity to pick your brain, and I feel like you've shared so many healing things in this conversation. I know everybody listening is going to be really, really appreciating this. I know it's been great for me, and I know everybody listening is going to love this. So thank you so much for being here with us, Dr. Kasey.
Thank you for having me and for setting all of this up. It's been wonderful.
Yay. And everybody listening at home, I hope this conversation will be healing on your healing journey. Thank you so much for joining us. Until next time.